I'll just take 5 minutes of the starting because I just want to give an introduction as well as welcoming all the participants. So just give me 5 minutes. I'll complete it as soon as possible. Then I'll take like I can give it to you, Dr. Ashish sir.
Yeah.
So a good evening to everyone and welcome to Gyaan Vardhini Session. I am Aarti Mishra from Team Cleansev, and it's truly a pleasure to have each one of you joining us today. It's an honor to have you all here as we embark our another enlightening journey of wisdom and knowledge enhancement. Today we have a privilege of welcoming our senior most speaker, Dr. Ashish Phadke. He is a renowned Ayurveda, yoga, and eye consultant with an impressive array of qualification and accomplishments. He's also a founder of Ayurvision, Center of Ayurveda and Panchakarma Therapy, and serves as an honorable deputy director of the division by endocrine and metabolic disorders at Kasturba Health Society Medical Research Center. Dr. Phadke's qualification also includes MD Ayurveda, Mumbai. He has done PhD philosophy in yoga, MIIM gold medalist, MS psychotherapy, MA philosophy yoga, advanced diploma in yoga, diploma in yogic education. Also, he has done DBM, DMM in marketing, DIT, and CHT. Uh, Also, Dr. Phadke has expertise in extend beyond the traditional medicine with the certification in clinical hypo hypotherapy, relational, rational emotive behavior therapy, and conjugative behavior therapy, and more. He's a prolific researcher with numerous publications in national and international journals, as well as the contribution to textbooks and articles. Dr. Farke has been also invited to speak and conduct seminars around the globe, showcasing his wealth of knowledge and experience. Today, Dr. Farke will be sharing insights on the topic of Sattvavajaya Chikitsa, theory, theory and practice. We have a privilege of having him with us, and I'm sure his presentation will be both enlightening and thought provoking. Once again, a warm welcome to all the doctors and Dr. Ashish Phadke. Over to you, sir. You can start with your webinar.
Thank you, Hari Om. First, let me thank organizers, my dear colleagues, Dr. Snail and Dr. Hima, and Mr. Anand, me at this particular platform. Well, friends, we are having a very different out-of-box topic, and that is Sattvavajaya Chikitsa, theory and practice. Why particularly I'm mentioning this title? Because if you see the syllabus of our BAMS curricula, you will remember that there is only one line description on this Sattvavajaya Chikitsa. And in Manas Rog Chikitsa, it gives, passing by reference of Sattvavajaya, right? Hardly we ever ponder into this particular principle in actuality, in practical way, in our earlier phase of our learning Ayurveda per se, right? So I always used to wonder when I was student, then I used to teach in college. Then also in those time, I always used to find out how and why this particular topic has been devised and why it has been kept in this particular samhitas. And we all, next slide, please, Snail. Hello. Yeah. So before we actually start, we have to remember our Lord and Patanjali, because Patanjali is one who is into yoga, and we have got a very close contact with Sattvavajaya and that of yoga. So we remember, we bow in front of both uh, Dhanvantari, and we know the prayers that Avir Babhu Kalasham Tadadyarana Vadyam Piyusha Purnam Amaratva Krutte Suranam Rugjala Jirnatvam Janita Prashamsa Dhanvantari sa Bhagavan Bhavikaya Bhuyat. That is the prayer of Dhanvantari. And Yogena Chittasya Padena Vacha Malam Sharirasya cha Vaidyakena Yopakaruttam Pravaram Munina Patanjalim Pranjali Ranatosmi. So by remembering these two, we have to go ahead with. And none other than our own gurus. And I was lucky to have training under number of numerous gurus up to the last phase when I'm right now also I'm learning under our beloved Dr. Gala sir. So all my gurus from Ayurvedic field may be our teachers, starting from my home, because my mother and father both are Ayurvedic physicians. So I started my learning initially with them, and then later on from stalwarts like Vaidya Veni Madhav Shastri ji, then Vaidya Kanitkar ji, and then in our own college, Vaidya Goradia sir or Vaidya HP Sharma sir, and many more. And finally, in between, I came across in touch with Dr. Gala sir, and still I am going to him, and he's my guru and all of us guru. Most of these members, those who are listening, I'm sure they are all students of Gala sir. Now coming to the topic, next slide, please. Hello, next slide. Okay, so in our syllabus, we have seen in Charak Samhita, we have seen that Ayurvedic Chikitsa is not just unifold, it is considered to be trifold. And there are three modalities of Ayurveda treatment is known to all of us. Discuss on two levels. One is like Trividham Aushadamiti, Daiva Vyapashrayam, Yukti Vyapashrayam, and Sattva Vajayascha. So, Daiva Vyapashray and Sattva Vajay is comparatively utilized much lesser, right? Direct way. Whereas Yukti Vyapashray, we all know that in Yukti Vyapashray, we use basically medicaments, we use particularly formulations or medicinal plants to make sure that increased vitiated doshas will come back to the normalcy, and then we treat that situation. But then in Daiva Pashe, they have spoken about particularly mantra, Aushadhi, Mani Mangala, Bali, Upahara, Homa, Niyama, Prayaschitta, Upavasa, Swasti Nayana, Pranipata, and Gamanadi. So these are the areas of Daiva Pashe. Today I'm not going to specifically speak on Daiva Pashe, but again, I need to mention that most of the time when we are getting out of this whichever Ayurvedic institutions, very rarely people they speak about the importance of the Devapashray in treatment modalities. And then comes the Yukti Vyapashray, we are aware of that Puna Ahara Aushadharvanam Yojana, and then again in Tika they have said that Bahi Parimarjan, Anta Parimarjan, and Shastra Pranidhan. So likewise, it has been discussed, which we are not going to get into depth because we all are aware of it. What is last that is there is Sattva Vajaya, and only one line has been explained, that Puna Aitebhyo Arthebhyo Mano Nigra, and that is what is Sattva Vajaya. Okay, now what is important, which we must understand and we should remember, that while they have done this classification, this compartmentalization, may it be Yukti Vyapashraya, which is commonly used, or second level we are using Sattva Vajay, and very rarely we are using this Daiva Vyapashraya. But then they have mentioned in the scripts or in the uh, Tika, Ayurved Deepika Tika by Chakrapani Datta. Next slide, please. That Samprati Prakarantareno Upayuktam Vaishajya Traividyama Sharira Ityadi. So there is a Praya Shabda. Actually, in this, I am not reading the entire Tika per se, but there is overlapping use of Yukti Vyapasya Chikitsa and particularly even in one sec, be there only. Shari Rog, and especially in Unmad, Apasmara, which are considered to be Manas Rog, in the form of Anjana and other internal medicines. But even Davyapashray is utilized in Charir and Manasro. So both these are vice versa. You can see the interchanging use or mingling with each other, and at the same time you can also see that even Sattvavajaya is into action. Next, please. Now, what is Sattva, Ajay? Now, again, you may see, oh, what is this? Dr. Phadke is saying all this theory which we have done already. So why to go back to that theory? But you will realize why I'm revising this, because there's a big gap, right? So Sattva Vajay is a term which is made up of two terms, Sattva and Avajay. And first year Ayurveda years when we learned Sanskrit. And in Sanskrit, we learned Sandhi, right? In Sandhi, there was a sutra of Echoyavayava. So if you have Sattva and Avajaya, so A becomes double and it becomes Sattva Vajaya. Okay. Now here Sattva can be understood with two ways. One is Sattva Rajatama, one of the guna of Triguna, and that is what is Sattva. This is one interpretation. But the other more important interpretation in our today's context is Sattva is also considered as or mind, right? So here one should understand Sattvavajaya in either way is to increase the level of Sattva, that is Sattvavajaya, or to Avajaya means to withdraw, to overcome, and to conquest. Okay, conquest. So, Sattvavajaya means to withdraw the mind from the unwholesome object or to overcome difficulties of the mind. That is one. It also implies achievement of balance between sattva, raja, and tamas that are controlling factors of mind. But here, rather than balancing, you see the game of the movement of the activity of converting rajas and tamas into sattva. Whether you see yoga for that matter, when we speak in yoga, that Ashtanga yoga, particularly I'm Patanjali Yoga, that there is a Ashuddhi, and that Ashuddhi of Rajas and Tamas, which is increasing, will put yourself in a distracted way, right? And to achieve the position of what we say yoga can be understood by Yuja Samadhav in that context, not Yujam is to join, which is very wrongly and very loosely translated per se in commonality. It is true for Hatha Yoga, but for Patanjali Yoga, it is Yuja Samadhav. So in Samadhi, that Ashuddhik Shaya is attained by reducing the amount of Rajas and Tamas and increasing Sattva. Okay, and here again, Avajaya is also increasing, conquering Sattva. In that sense, also we can understand that Sattva Vajaya could be two-way, overcoming the difficulties of mind or withdrawing the mind from unwholesome objects. That is one, and increasing the level of second level. It also works with an objective to increase that already I mentioned that. Okay. Now it can also be understood in the contemporary light of new psychotherapies. And what are those psychotherapies? As simple as counseling, which is nothing but a talking therapy. And they have got multiple array of therapies which is prevailing in today's context. Most of them, and one of the most important one is cognitive behavioral therapy or rational emotive behavioral therapy or positive psychology and things like that. So we have to understand this particular topic of Sattva Vajay, not only from Ayurvedic perspective, but also from the perspective of the therapies on mind which is existing today, and to know how we can understand these therapies, modern therapies, so as to make the proper implication of the principles which has been mentioned in Ayurvedic texts on patient in a practical mode. Otherwise, what happens? It remains up to the level of writing Sanskrit in the examination, in the papers, getting good marks, and bye bye. So it shouldn't happen. It should be able to apply those particular principles in day-to-day case, level. Now, going ahead, next, please. Next slide, please. Now, again, the word Sattvavajaya comprises of Sattva and Avajaya. Already I have mentioned that, and it comes from the root Sat, adding suffix Tova, that is Sanskrit part. Forget that. Uh, Coming down, that the another meaning which we have found out from other dictionaries that I am trying to put forth is overcoming victory, and the word Sattvaja refers to command over self and strength of mind. So please pay attention to these particular words. Command over self and strength of mind is also equal to Sattvaja, or overcoming victory. In other words, Sattvaja means overcoming of mind or now, controlling of mind is again going close to what we have otherwise learned in yoga, particularly, right? So, yogastu chitta vritti nirodha, that is the sutra in yoga. Now, Sattvavajaya punaha ahitebhyo arthebhyo manonigra, that is the sutra. And here, when we say ahitebhyo arthebhyo manonigra, but before that, there is puna. And here, ahitartha and manonigra are the two basic principles of Sattvavajaya Chikitsa, and we have to pay attention to these two cardinal principles in this particular treatment modality. Now, ahita is with reference to, or with respect to, Panchendriyartha and Manoartha. So, ahita for Panchendriya and ahita for Manas. In that case, in that sense, we have to understand in this particular context. But in Sattvavajaya, it is quite logical to consider that Manoartha, though it may not be objectionable to include Panchendriyartha, because ultimately it is Sattva that materializes the perception of the and not the Indriyas, because we all know what is the Jnanopalabdhi which has been mentioned by our Ayurveda. So Atma Manasa Sanyujate Mano Indriyani Tadartham Tad Vishayam Tadartham Tad Jnanam. That is the entire lineage. So Indriya can be included under Manas. So in that sense, it has been mentioned that we have to give more importance to Manas and Manasartha in that sense. Now, Asatmendriyartha Sanyog is regarded as one of the major cause of disease, and Ati, Hina, and Mithya Yog leads to different Manas Rog, and not Manas Rog, but otherwise also Shari Rog, because Pradnyaprad and Asatmendriyartha Sanyog, they are considered to be one of the major culprit, one of the major etiological factors for generation of or pathogenesis of different diseases. That and in that case, to control this particular therapy or this particular approach or attitude of mine will be utmost important. Somewhere I have read, and this is very interesting, I am reading it in original in Marathi, that सत्व इक्वल टू मन आणि क्षणिक सुखासाठी अहितकर गोष्टी करण्यासाठी होणाऱ्या मनाच्या प्रवृत्तीचे नियमन करणे. सी whenever we do anything, any activity of mind for the splitting fraction of say pleasure, then that kind of activity of mind can be controlled by the act of Sattvavajaya Chikitsa. That is what they are trying to aim at, or they are trying to say that. And because of this, what we can do is we can control our Prajnaprad and Asatmindriya Artha Sahyog, which are otherwise known for creating diseases, right? And that's how they are giving importance to Sattvavajaya Chikitsa. Now, I'm just asking you uh, mm, uh, one question. Wow, one sec. Huh? I'm just fine. Now forget these slides and all, and just retrospect yourself and cross check whether you have done this Sattvavajaya Chikitsa in your practice. The most of us may answer that no, we haven't come across, or we have not used it. I know many of my colleagues from Galas's group that they are following Vipassana, though I'm not doing myself personally, but I know many of my colleagues they are doing it. And Vipassana is one of the tool which can be utilized for doing Sattvavajaya. One of our another colleague, one of my friend, he is conducting a program on Sattvavajaya Chikitsa. He claims that I am creating Sattvavajaya Chikitsak. That is what he is claiming. And the methodology which he is using for his entire program is based on Vipassana. That's what he mentioned to me while in one of our discussions. So what I'm saying that except these few, do you think that all of you have used Sattvavajaya Chikitsa in your day-to-day practice? And if answer comes no, then let me tell you that you have used it day out without your knowledge that you are using it. I repeat this very carefully that we all of us we use Sattvavajaya Chikitsa in a different mode without knowing that we are using Sattvavajaya in our daily practice. Because I started with saying that all these Trivida Chikitsa, Daiva Vipashraya, Yukti Vipashraya, and finally Sattvavajaya, they are there, they are mentioned in the script, and they are used interchangeably. Sometimes they are used in combination with each other without having knowledge. We are making use of it. How? For example, you come across a case of, say, severe arthritis. Let us take example of common arthritis, rheumatoid arthritis. And a patient is coming to you, sitting next to you and saying, sir, I'm bothered, and uh, I'm not sure that whether I'll be able to of this. And then immediately all of us we say, don't worry. If you follow Ayurvedic principles, if you follow diet rules, if you take medicines religiously and regularly, definitely one day you are going to overcome your problems, and don't worry, you will be all right, isn't it? You come across cases, even severe cases like cancers, or you come across cases like earlier period COVID and whatnot. And in all those cases, you try to give boost to your patient. Okay, you try to change the modality of his negative thoughts into different mode by virtue of explaining him and making him think about the entire situation differently. And that is what is also what you are using the principles of Sattvavajaya in your day-to-day practice. Now, further course of slides and further course of my speech will be focused on how these methodologies are developed and how it can be utilized in case specific way. So in that way, we will be studying little further. Okay. Now, next slide, please. Yeah. So ahitebhyo means harmful and unhealthy. Now we know hitahitam sukham dukkham. So hita and ahita we are familiar with. Similar way, ahitebhyo is one of the form by grammar. So of whom? To of that of arthebhyo. Okay, so here artha is not artha karan wala artha, that is not money, but artha means the object of sensory organs and mind. Okay, so ahitebhyo, arthebhyo is together, to be understood together. And manonigraha, it refers to the controlling of the mind. And then I am mentioning about this puna. Puna means to do again. Puna means repeating. Okay. So to do again. Sattvavajaya puna ahitebhyo arthebhyo manonigraha. Now, this is the word, this puna is very, very crucial and extremely critical in our undergraduate level. Probably we might have not paid attention towards this particular part. The word puna is giving of a U-turn to go back to the original state of sattva, which has been deviated by those set of patients from where the person has deviated. So it is not about learning new skill to that extent or competencies or attitude or behavior, but it is reconnecting with the what it is our original state of manas or sattva. Now just pay attention to what we usually greet each other whenever we meet someone or call someone. Then the first question is, how are you? And the next person is about to say, I'm fine. Or he ask you, how are you? And then we say, I'm fine. Kaise aat, baryat na? That's what we usually say. Kaise ho, achhe ho? But we never ask you, aren't you unwell? We never ask that kind of question. Because to be well, to be all right, to be in a happy condition is our original state, and that is what we all are familiar with. And whenever we go, we drift from that wellness, or we drift from that uh, uh, you know uh, feeling of good, then there is something, and that's what the essentiality of this kind of comes into picture, and to make us know that how we can do U-turn and come back to the original state of sattva. So it is not about learning new skills. It is reconnecting with what is our original state of manas and sattva already we saw. The manas which has the tendency to go outward, usually manas and panchendriya also, they are having tendency to go outward. Okay. And also has willpower or a bala, we call in Sanskrit, in Ayurveda, bala, to make the manas to go inward and restrain itself. And that is what is the particular entire area or entire shastra of how to control manas, and how to make the process of outward or outgoing indriyas to be getting controlled. That is yoga. And in particular yoga, yama niyama, asana, pranayama, pratyahara. In pratyahara we try to do this kind of. Now Sattvavajaya is the support that a therapist gives to a person or to a patient to inculcate this bala or this strength and win over the outward going of his or her pancha jnanendriya, okay, or his mind or her mind. The therapeutic modality that restrains the mind from desires from unwholesome objects by increasing the sattva guna, that is good quality of mind, is known as Sattvavajaya Chikitsa. This is the simplest understanding and simplest definition which we can create or we can understand with. So Sattvavajaya is not a rocket science. It is simply giving advice in a methodical way to the patient that he will turn from unwholesome to wholesome. Okay, ahitebhyo arthebhyo to hitakara artha. Okay, of the manas. So that is what is Sattvavajaya Chikitsa. Next slide, please. Next slide, please. Snail, next slide, please. Yeah. Now, if we see 17th century AD, one grantha, that is Ayurved Saukyam. In Ayurved Saukyam, written by Todarananda, he has specifically added, apart from Mano Nigra, that the Dhairyadi Vijnanam, that is deeper understanding of intellect, fortitude, etc. And in the that Aitebhya Sada Artebhyo Manonigrahanam Tatha Dhi Dhairyadi Vijnanam Sattvavajayam iti uchyate. Sattvavajayam uchyate. So in Sattvavajaya definition of Tiraka has mentioned, you can see one more addition, that Dhi, that is Buddhi or intelligence, then Dhairya, that is patience or fortitude, And Adi is a term which includes some more methods such as Vijnana or scientific in nature, and which are those we will be observing later. Next, please. Then in Vagbhatacharya, in particularly Ashtanga Hridaya, you can see Dhi Dhairyatma Adi Vijnanam Manodosho Aushadam Param. So here it is very clearly mentioned that we need to transcend the manas to allow buddhi or intelligence to play the role. Okay, is very important in Manodosha. So unless you don't understand, you don't grasp that particular concept on a conceptual level, why I'm supposed to do, then whatever you say, patient will not be able to understand. So what is more important in Sattvavajaya is to make patient get convinced, and convince and conviction, both things are very clearly playing role in this particular way, and it has been clearly mentioned by Ashtanga Hridayakar, that is Vagbhatacharya. Next, please. Charakacharya has also mentioned that Smriti and Samadhi are also important aspect of Manas health. Okay, so Manasodhyana, Vijnana, Dhairya, Smriti, Samadhi. Now, these are the shloks which we have by hearted and written in exams. But do we really understood the hidden meaning, and do we apply them in clinical practice? So, friends, just see Manasodhyanam knowledge. Now, self knowledge is pertaining to the patient's self knowledge of that particular condition at that particular situation, what he perceives, and to make him aware that look, this is not the wrong perception which you are holding back, but this is what is the real perception. So, psycho education or psychological education, that is Vijnana in this case, Manaso Vijnanam. Then Dhairya, that is patience and willpower. Unless a person is not having willpower and patience, then he or she will not be able to overcome that situation, even though you are there to help that particular patient. So you have to inculcate that inherent properties of dhairya, which is there in that particular patient, and take help of that dhairya. Then smruti, that is memory. So in first session, you have explained certain things. In second session, third session, you go on explaining, you ask also him about his past experiences, whatever he has dealt in his earlier days, childhood days, or things like that. So in all these particular series of conversations, memory also plays very important role. And here samadhi means not the samadhi which we are actually understand in yogic way, because that is something completely out of box. But here it is self transcendence. Samadhi is self transcendence, because if he is not able to transcend from whatever concepts or whatever ideas, ideation, then it will be difficult to make the transformation in that particular patient. And in that case, manasodhyana, vijnana, dhairya, smriti, samadhi can be understood in a newer light, in a newer contemporary light of mental health. Next, please. So Sattva Guna is illuminating in nature. Sattvam Prakashakam, we all know from our Sankhya Karika. Here, illumination refers to knowledge that help one to know the true and ultimate nature of anything in this world. So again, here we must remember and we must acknowledge the wisdom which has been given by Bhagavan Buddha. If you know the basics of Buddhism, one of them is that anityam, anicham or anityam, and whatever is there, it is not permanently. If you can give okay, and make him understand that this is what is the world and this is not the permanence. So your disease is not going to be permanent throughout. Then one second, can you intervene and tell sir that the voice is, sorry, my voice is not audible. Hello.
Sir, it's breaking in between. I guess there's some internet Uh,
My voice is not audible, madam?
sir, it is
Okay, okay, I'm
audible,
confused.
but it is breaking.
Maybe, possibly.
Yeah,
No,
there might
it
be some
is
internet issue.
okay. I'm going slow then. Okay, no problem. Ah, so maybe. Where were we? So no, here illuminating refers to the one to know the true and ultimate nature of anything in this world. Therefore, empowering the person with the knowledge about certain things that are leading to distress and giving knowledge about methods to handle and cope with these events is done in Sattvavajaya Chikitsa. Here at this point only, I'll say that there are certain hints which are given in these scripts, our Ayurvedic scripts, which we'll see. But cognitive behavioral therapy or RBT, they are going to play a very
Uh,
vital role. For example, there is something known as commonly very many patients come to you and they say, "Sir, ये तो मुझे समझ में आ रहा है, but then I am not able to control my thoughts and I am not able to control my negative thoughts." Okay, then what to do? So, in that is typically called as automated negative thoughts. That is known as ANT, automated negative thoughts. Automated negative thoughts has got particular, characteristic feature. For example, uh, uh, these thoughts are usually irrational. These thoughts are usually exaggerated and can contribute feeling of anxiety, depression. Uh, so speak your speaker. Dear, my speaker is okay, but I don't know whether there is any problem with internet. Am I audible or shall I stop?
so you're
Headphones.
audible,
No, I'm
but
not using.
if you can, you're audible, sir, but if you can just change your internet connection, if possible, then you can connect to some other
No,
connection.
I have only. No, I have only this only. I don't have any other connection.
Because your voice is breaking in between.
All right.
Yes.
It is flickering. I can see it is flickering. I know it is flickering. Now is
Uh,
it okay?
yes, sir.
Is it okay?
Yes, now it is okay, I
Okay.
guess.
So
Yeah.
that is what these are negative automated thoughts. Now, how to convert this negative auto positive way? So this is what we are actually looking at. I'll deal on that aspect. Maybe not immediately now. Let me finish the part which are connected. Then I'll go with these modern aspects. Okay, next slide. Yeah, already I have explained this, so I'm not going ahead with this, but we have to remember this Atma Manasa Sanyujyate. Already I have discussed this. Next. Now, Indriya Vigraha Karma Manasa Swasya Nigraha Uho Vicharascha Tata Param Buddhi Pravartate. So this is another sutra, and here Indriya Abhigraha denotes control over one's Jnanendriya or sensory organs. That is all eye, ear. I am not saying that. And even Karmendriya, that is motor organs. Then Swasya Nigraha, that is having control over activity of mind itself or being self-restrained means Swasya Nigraha. Now, self-restraint is again not to the extent of what we expect in yoga, okay, Patanjali yoga, but in a little different way for clinical applications. Now, Uha is the ability to analyze or being able to speculate both way. So Uha is to be understood in these two ways: ability to analyze the situation and being able to speculate. So if you are in X situation, which is very bad situation, you are thinking of committing suicide, and a person is telling you that I have tried to commit, but I couldn't succeed, and I am not able to continue with this. So for him, you have to help him, or you can hold his hand and do analysis, and you can speculate about his own futuristic situation where he can be completely out of this negative thoughts. problems, and that is what is uha. Then vichara is thinking or decision making or having controlled thoughts process, that is vichara. Just now we few second back we saw automated negative thoughts, so which are uncontrolled, okay, which are irrational. So exactly opposite is vichara, which is rational controlled thought processes, and that is what is vichara. Next please. So already we saw this manaso jnana vijnana dhairya smriti samadhi. So here jnanam adhyatma jnanam, vijnanam shastra jnanam, dhairyam ananna anannati chetasa smriti. So all that, whatever has been mentioned, coming down to knowledge of self, it includes basic understanding of the concept of self that comprises of knowledge about having three different components of body, mind, and energy. So all that has to be understood by jnanam. It also includes the understanding that a human being is not just a body or a mind, but something beyond that. So when a person comes and sits next to you and say that, sir, I'm a diabetic, then you have to tell him that, look, you are not diabetic, you are Mr. So and so. And Mr. So and so is having diabetes since so many months or so many years. So you have to make it very clear next to them that that person as a whole is actually transcending not just mere physical problem, not just mere mind problem, but it is a conglomeration of all those things together. Now, Vijnana also denotes knowledge of Shastra, that is doctrine, and the doctrine is basically coming from reference to Vedas, Upanishads, and other literature from ancient Indian Sanatan Parampara, and offer on important aspect about life and nature of self. This is what is to be understood when we read text, okay. But when you go little, one step ahead, then as I mentioned few minutes earlier, you can think of learning philosophy from Buddhism. You can learn philosophy from Jainism or Zen or any other philosophies which are going to help us in explaining our patient and take him further on his course. Next, please. Now, coming down to dhairya in specific, dhairya can be courage, courage to face the problem, then strength and steady conduct or patience. All that can come under dhairya. It is that quality of a human being which make one strong and persistent despite failures or obstacles in the path of success, and that is what is the quality of resilience. So resilience is also can be equated with that of dhairya, okay. The one who possesses this quality can see the light beyond the obstacles in the path, and this ultimately takes him desired destination, success, and all of that is wished for in his entire process. Now, here I would like to give another example of those set of people, set of cases, or set of victims, rather, I should say, those who have been, put to concentration camps in Nazism. Okay, and every moment they were not sure whether next moment they will be alive or not because of the horrifying experiences and horrifying situations created by those Nazi Gestapos and officers in that particular concentration camp. But in spite of all these odds, even though they were not getting proper food and proper, basic needs of sustaining to life, many of those they survived after such a long period when Germany actually defeated by America and other countries. And when these people were interviewed, psychologists, medical sociologists, and psychologists, then he particularly asked them question that how you were able to sustain, how you were able to survive, and they said that we were aware that there is someone who is going to be there. above all these Nazis and whatnot, and we were having definite, you know, uh, what we can say, courage, and we were having definite motto that we must live life, because we are not there to end up our life over here, and we are supposed to do something good even after we come out of this concentration camp. Now, friends, this is very, very difficult, and this is very, very unique experience, and this is possible in only few sets of people, those who have that kind of characteristic feature, and that is what can be controlled with dhairya. Now, dhairya can also be seen in number of cases of terminally ill conditions, may it be cancer, may it be anything else, or cases with long standing or long standing difficult situations. But in them, their level of the area can be improved many folds by mere counseling with them in an appropriate way, and you can see the change in the mental attitude and shift in their results, and that's what is the importance of dhairya. Now, smruti is memory or capacity to remember. This makes one capable of understanding the association between cause and the effect. Okay, this is very important, because when you say particular patya to patient, and when you just don't say patya but you explain them the relationship of patya and that of increase of or decrease of dosha and your pathogenesis basically, then while eating particular food item, patient they recall, oh, doctor has mentioned that eating particular spicy or eating particular sour thing will increase my pitta level, dushta pitta level, and if we don't follow that, it will get worsen, and then they don't eat. So there is a twofold thing which we need to remember here, that they are also exercising smruti part, and they are also exercising mindfulness. Either way they are doing it. Okay, so Sajagata is also important. Aware Sajagata is awareness. So that is moment to moment awareness. So that is also important in this case of Smriti. Now this aids intellect to decide the right things, actions, and thoughts. So based on that, based on Smriti, you can take the right actions and right mode. Ultimately, careful decisions making and problem solving can be achieved by Smriti. Now, samadhi, that is complete absorption or meditation, leads to samadhi, definition in yoga and all. But here it indicates the state of being in unison with that of Parabrahma or Paramatma. That is another way in certain terminal ill cases. And they have been told that, okay, even though you leave this particular, Mother Earth, but you will not be, getting completely out, because you are there as a principle, conscious principle. So that kind of counseling is required in a particular states of patient, not in all patient, but state of patient. So it is that state in which being realizes the true nature of life, its separate nature than the mind and body, and thus the pain gets disappears. Now here I would like to give examples of Paramahansa, the Guruji of Swami Vivekananda, or Raman Maharshi ji, in whom they, particularly Raman Maharshi and Swami Vivekananda also, particularly in Maharshi, he had a cancer on his arm, and he said that you do operation without taking any anesthesia. And because he had that kind of, okay, he was the evolved person, different of all the way level, that all agreed. But if you analyze that particular situation, then by mere understanding who am I, will uh, achieve that kind of situation without having any anesthesia. The pain factor was controlled in a great way. It disappeared means it was not there. It's not like that. But how to react to pain was different in his particular case. Okay, next please, next slide. Now, when we speak about techniques in Sattvavajaya Chikitsa, then we have to go back to our first year and first year subject, which is not that commonly liked by many of us, and that is Padartha Vijnan, right? Ayurvedic metaphysics. And in Ayurvedic metaphysics, in Ayurvedic Padartha Vijnan, we spoke about Manas in great details. And in that, we learned about different aspects of Chintyam, Vicharyu, Yamcha, Dhyanam, Sankalpameva, all that. But when we speak about Chintyam, then we just mention the translation as a Chintan. Chintya means to think about. But how it is to be applied in clinical practice? So see, here are some of the pointers which we can be take it down or understand and can take to our help while our history taking or while discussing with the patient. So by regulating the thought process is the motto of Chintya. So by regulating the thought process, some important techniques or steps in promoting jnana and this particular Chintya is recognizing and correcting negative automatic thoughts. So recognizing and correcting negative automatic thoughts. Already I mentioned before we start thinking whether ये मुझे possible होगा कि नहीं, whether I'll be able to achieve or not, whether I'll pass the exam, whether I will be able to treat this patient. So sometimes we have to give Sattvavajaya Chikitsa to ourselves and not patient. And if we give proper Sattvavajaya to ourselves, then we proceed and then we can give Sattvavajaya Chikitsa to patient also, right? Then teaching reattribution techniques. So you have to teach patient in a bit by bit, then increasing objectivity in perspective, keeping spiritual understanding of life. Now that is already we have discussed few examples. Identifying and testing maladaptive assumptions and decentering. So sometimes some patients they have some vague ideas. Some people they come to you and say, "Oh no, I don't want to take panchakarma because panchakarma will make me a lot of loose motion. It will not suited to my body." When we give Agni Karma, then they say, "Oh no, I don't want to, create burns to my particular body." So basically, we have to explain them, uh, you know, step by step and uh, cancel those maladaptive assumptions and decentering behavior. Now, behavioral techniques can be activity. Hello.
Mhm.
Snail.
Snails, your network has gone, I guess. No, sir, your
Array,
screen
it
is
is
not visible.
now even here also it is not visible. So what should I do? Is it
Uh,
continuing? My voice is coming.
so your voice is coming. Snails, sir, from your side, the screen is not visible. Kindly reshare it.
Okay. Or I'll anyway speak out. People can hear if they hear properly. Is there a problem with the voice still?
No, sir, you can go ahead, but
Okay.
if the
Then,
yeah,
uh,
screen is now, I guess,
yeah.
visible.
No, no, not yet. Not yet. Anyway, so in behavioral technique, you have to do scheduling, because what happens is when you have got a lot of tasks to do with and patient particularly, then there is a great problem for them. So you have to do time management skills and you have to do activity scheduling. You have to help your patient in doing that. Homework assignments, you have to give some of the homework assignments so that they can actually observe that by doing this kind of restructuring of the work, how they are feeling, what are the level of stress, how they are feeling happiness, or how is the level of their sleep pattern. Done, then graded task assignment. So you can give them graded task assignment, behavioral rehearsals. In some of the cases, we do, role playing. We do role playing exercise. If a family is there, then we interchange the role of father's role to, say, a son or to a daughter, and then we ask them that you behave as you require your father to behave with the family, with you, and things like that. And then the person who is actual father, he will get amazed or he will get shocked that what there are expectations from the other side. Okay, then role playing already I said. Then diversional technique, so you can ask them to inculcate or cultivate different kinds of hobbies, and that will be of great help to them. Then teaching problem solving skills. So you have to teach them problem solving skills, because some of them, they are in the position of master or the leaders, and in their organization, in their particular group, when they are actually head, then they are not able to cope up with the problem created or faced by their subordinates. So if they know these kind of things, then it will be great use to them. Then you should give insights to them, that is punar shikshan, and re-education and insights, that is punar shikshan and vicharana, that is to be inculcated, because some of the people, they have got some fixed sets of thoughts. So in those cases, you have to explain these methods, and that in a great way. So there are papers by Dr. Kapadia and Mala Kapadia and Dr. Tripathi. So you can get more details from them. Now, next slide, please. Now, Vicharya, Uyam, Vicharya. So Vicharya is replacing the negative ideas and thinking pattern. This is very, very, very important. And this replacing negative ideas and thinking pattern
Hello.
is
हाँ अर्षा पता
exactly
बोलो ना क्या बोल रहे थे.
specified. Sorry. Hello.
So sorry, you can continue, sir.
Mentioned. Sorry. Okay. So it has also been specified by modern psychotherapy. Okay. Now, whatever I have spoken about these negative automated thoughts, they can be prevented by what is termed as, CBT techniques, cognitive behavioral techniques. And what are those techniques? So CBT techniques are mindful technique, where you stay in the present moment to moment you live, and observe your thoughts without passing any judgments. And when you do that, you don't get hooked to or anchored to, and you don't get involved into that particular situation. You don't relive that kind of situation. Then slowly and steadily, those particular situation come next to you. You recall them. They come next to you, and they slowly get weavered off. Okay, and that doesn't create pain to you. So basically, you have to learn how to react to that particular without getting involved. So that is what is mindfulness, again, which is coming from Buddhist philosophy. Vipassana is one of the tool which one can learn if one wish. Okay, then cognitive restructuring, that is another methodology which has been mentioned in cognitive behavioral therapy. And what is cognitive restructuring? So challenge and reframe this ant matlab mungi, and ant matlab automated negative thoughts, which are actually creating, जैसे ant चुभाती है अपने को. That's what these thoughts are also creating, biting our mind, biting our entire head. So by examining the evidence for and against for these kind of thoughts, okay, replace them with more balance and realistic thought. I give example once again. You may come across patient who is absolutely in anxious state, and having anxiety for appearing for exams. Okay, I have come across one patient late night. She was one of the last patient. Tried to commit suicide that time of point. Okay, and when I said, why you have done, dear, because you are supposed to be good, your prelim marks were fine and everything was fine, 10th standard student. Okay, but because she was hefty, she tied that dupatta around her neck and tried to hang herself on the grill of the gallery, and because of her weight she fall down, and she could survive. But when she was brought to clinic, initially she was not speaking a single word, but then using some other technique she started speaking. That time I had to pose questions, and posing question, particularly this cognitive restructuring, what we do, we ask to create the questions. You require to create challenges to what that patient thinks about. So the question was, do you really think that you will fail? Do you really think that you will get less marks? And if so, then why? If you think you don't, then to do this kind of act and things like that. And then you have to ask the previous history. Their smruti comes into play, and you can give the evidence that look, you had better marks, rather good, very good marks in your prelims, in your ninth standard, or in your in between exams, sarav pariksha and all that. So why you wanted to do this? And that is what actually triggers and boost up our morale. And then over and above, you give medicines. Over and above, I use in Devapashe some other methodologies like chakra therapy and all. So that helped. But this is what that cognitive restructuring is there, and you have to replace those particular thoughts into realistic and balanced thoughts. Okay. Now, this replacing of thought is also mentioned in yoga also. Huh? That is Pratipaksha Bhavana. There is a sutra of Pratipaksha Bhavana. So they say you replace the thought in an opposite way. See, if you say don't recollect, then you will recollect even more. Don't seek purple kangaroo in front of your close eye. You close eye and say don't see purple kangaroo, and you will see it. That is the law of psychology. So you never say don't see, you say okay, you want to see, see. But then you also remember something is completely opposite. And when you see completely opposite character, something happy, something pleasurable, something good feeling, then that takes over that of bad feel, or pain or misery. Okay. Now this kind of technique just now I mentioned was vitarka badhane pratipaksha bhavanam. That is the sutra from yoga, and this is the practical implication. Now there is another technique or methodology which people they use nowadays, and that is NLP, neuro linguistic programming. And in that, what do? We give anchoring. Now while giving anchoring, even when I perform hypnotherapy, clinical hypnotherapy, so in that also we use anchoring technique. Now what is anchoring? Now person is already next to you, suffered from PTSD, post traumatic stress disorder, maybe sexual abuse, or maybe some very bad experience, somebody has betrayed or anything like that. So in that particular situation, that person is really really down, and in that case you put him or her to a situation where you ask that person to recall the best of best, happiest moment in his or her life. Okay, and when he gets anchored to that, then you slowly take out the topic very tactfully without hurting him, without getting him or her into shock, and then slowly replace that with this. So there are various ways. Okay, then positive affirmation is another important technique in CBT, that is cognitive behavioral therapy. So cognitive behavioral therapy, positive affirmation is you counteract these automated negative thought with affirmation that promotes self-worth and positivity. So most of these people, they have got low self-esteem. So in that case, you have to give them some affirmation that I am good, I have got these. I usually suggest to write down columns, what is good in me, what is bad in me, according to that person. Or I suggest to write what we call as a SWOT analysis: strength, weakness, opportunity, and threats. So when a person writes that, then he is actually doing analysis, and he's trying to look at those positive things which he has never looked at even once. And when he start putting down one by one, then he realizes, oh, I'm not that bad situation. So I can still fight out, I can still come out of this particular situation. So that is what is positive affirmations. Positive affirmations can also be inculcated with the help of what we call as self hypnosis. Okay, so you put commands, positive commands, and you ask that particular person to chant every now and then, and particularly while sleeping and while getting up in the morning, because that is the time when your subconscious gates are getting slowly open, and that seeps into your mind, and that actually manifests in your behavior. So that could be one of the another way. Then behavioral activation. So get these people engaged in activities that brings them joy, okay, or feeling of fulfillment, right? So let them do those activities when they are in pain or misery. And this is wonderful tool again in a people those with great pain in a terminally ill conditions as well. Sometimes they see that we don't have any joy or any fulfillment, but still you ask them to do that, because by doing it alone they will get distracted from that pain and misery aspect, and they will be on a track. Okay, in particular yoga, many a times people they think, oh, I know yoga, I've learned yoga, I'm a yoga teacher, so in case of depression, let me give dhyana meditation, keep eyes closed and focus, and you will feel better, enjoy, and that poor fellow is having great headache. Okay, or you make them lie down on a shavasana or chaitanyasana, and then the person is not able to lie down because there is a throbbing headache. Because the moment you close eye, all those old memories, which are bitter memories with bitter experiences, they surface up like a bubble at the surface. So in such condition we have to give different methods, and termed as cyclic meditation. So whereby there is a first phase of activity. So first you make them jump or you make them do Surya Namaskar vigorously, and then second position you make them sit quietly, do deep breathing or do little bit of Brahmari or things like that. So that has been actually devised by Dr. Nagendra Guruji and Nagaratna Didi, Dr. Nagaratna Didi from S. Vyasa. I was lucky enough to go there and learn from them directly. Okay, Osho Rajanish has also devised this kind of cyclic meditation, whereby in which he used to say people to jump, initially jump, and then there is a loud music and vibrant music, and people are jumping and dancing. And at a point of time when they feel very much, exhausted, then you are supposed to stop and start shouting, and you go on speaking to anyone about whom you have got rage in your mind, you have got some negative things inside your mind, so you take it out, or you cry or you shout or you scream, whatever. So there is a phase of catharsis, as he mentions in his work. And then finally you are supposed and do meditation or lie down and do shavasana. So these are some of the methods in these variations of behavioral activation, not coming into cognitive behavioral, but I have just given you another methods which are there existing in practice. Now there is something known as gratitude practice. So every day when you get up, you should feel gratitude towards yourself, towards everybody else, those who are helping you, starting from your family, your colleagues, peers, your doctor, and God finally. And that slowly create changes in the behavioral pattern. In yoga therapy, we have seen that people, those who are very angry and very agitated and aggressive behavior kind of thing, we suggest them to be in a pose of Shashankasana. And when you go into Shashankasan, when there is a whole head low and surrendering pose, you put your head down, or Balakasan. So in that, slowly their behavioral pattern gets changed. Then social support, you have to have a good support of family. You have to have a very good support of your peers, friends, and therapists also. Sometimes these people go on calling you. They take a lot of time, and there are a lot of sitting outside in your clinic. So you should not get agitated. You should be empathetic to them. You should give proper time and explain them the way they are supposed to be explained. So there is no shortcut in such kind of cases. And self compassion. So we have to tell them that it is happening to you, but you have to forgive yourself, because sometimes there is a guilt which is involved in such kind of cases. So you have to explain that, and you have to make them come out of those kind of guilt. Okay, so this is what is happening in this kind of uh, mm, uh, you know replacement kind of therapy. Now ahead you will see, in the case of mental derangement resulting from excess of desires, grief, delight, envy or greed, should be allayed by bringing the influence of opposite ones, that is contrast, to bear on the prevailing one and neutralize it. That is direct reference from Charak Samhita, Charak Chikitsa, Adhyay 9. And that is Kama, Shoka, Bhaya, Krodha, Harsha, Irsha, Lobha, Sambhavan, Paraspara Pratidvandva, Dvandvair, Revi, Eva, Shimam Nayat. So you have to, create another emotion in that particular moment and then manage and tackle the situation. Next, please. Now, uh, Uya, next slide, please. Uya is channeling the presumptions. Okay, Dheya is polishing the objective. So these are the other understanding of what we are otherwise reading in our textbook. Then Sankalpa, by proper guidance and advice for taking right decisions. Now, in Sankalpa is a very important part when we put our patient to yet another methodology which we call Yoga Nidra. In Yoga Nidra, you put Sankalpa in the beginning, and then you do certain procedures, and at the end, again you repeat Sankalpa. And that seeps into the mind. Okay, and that is what is been seen in his behavioral pattern. So that is what is also important. Now there is something known as Shruti Vakya, guidance and suggestions from the Upanishad and all that. All on that. Then Dhanartha Vakya, education of individual and family. So here Dhana means not the economical aspect, but the other way around. The patient should know the pros and cons of their disease state and healthy state. So that is also to be explained properly. Okay. Then the family is also to be guided positively to support the patient and his needs, because patient family is sometimes getting agitated. You require to give Sattvavajaya Chikitsa to the family member also. So sometimes you have to give a group therapy as a complete member of family should be invited apart from patient, and then they require to be given information about what patient actually suffer from, because they feel oh ये तो हट्टा कट्टा है इसको क्या होता है, but a patient of your rheumatoid arthritis, actuality really that kind of patient is not able to get up from the bed, and the other people they can't realize that. So we have to make them also realize that these are the situations. Okay. And about their patya particularly, they are further educated to behave properly with the patient, whatever the situations are. And that is what is required in chronic conditions, because that checks the patients of the patient and checks the patients of the relative. Next, please. Next slide. So yogic relaxation is part of psychotherapy. I'm not getting into that, but biofeedback is another very important, methodology, which is use of an instrument, usually electronic, which provides immediate feedback to the patient regarding his psychological activities, normally not available to the conscious mind, but at subconscious mind, whatever is going on can be understood using this kind of methodology. And they use EKG, they use EEG, they use BEG, EMG, they use pulse rate, they use blood pressure, and finally they use galvanic skin responses. So there is a big screen, and a patient is lying down, and the patient is attached with all these gadgets and all, and and uh, investigator is asking question, and he also shows the responses which are depicted in biofeedback machine. And after having some understanding of disease, or after having some counseling, or after having some yogic techniques, you see immediate difference, immediate lowering down of the values, and that is what is we see in biofeedback. So other use of biofeedback is in the treatment of enuresis, migraine, headaches, tension headache, idiopathic hypertension, incontinence of urine, then cardiac arrhythmias, uncontrolled generalized tonic clonic seizures, and also for neuromuscular rehabilitation. And also this is one of the technique which is used for screening the criminals, whether they are speaking right or wrong. This kind of technique has been utilized by police force, so that is also been taken into consideration. Next, please. Then in relaxation and stress reduction technique by deep breathing is one of the very important, and one need not even go ahead with teaching pranayam if you are not aware of pranayam, and if patient is not in a position to do that, then alone will also be very, very useful technique in this regards. But the only thing what one should remember is 1:2 the ratio, inhalation to exhalation, 1:2 ratio has to be kept in mind while teaching that, because that will improve the tone of parasympathetic nervous system, and that actually helps to reduce anxiety and all the other aspect. Now muscle relaxation or progressive muscle relaxation technique is commonly known. We usually use that PMR into our Shavasana technique. We use that PMR, or we use PMR that step by step you relax muscle from toe to head in clinical hypnotherapy as well. Okay, so that can be utilized if you have learned it correctly. Okay, then medical imagery technique is another, yet another, whereby you ask person to close eye and you give commentary and put him in particular situation, live that particular situation, and then he can get out of the problems. And finally deshatana, that is living space and going away. Sometimes particular space, if a person is living, then he will recall those particular event again and again. So the best way is to make that person move away from that part, and to take him to a nature or some good sightseeing areas that can help to reduce his stress. So that is what has been mentioned by many people. Now I'm not getting into this next slide, just go fast, go ahead. I am giving you examples of some of the Sattvavajaya Chikitsa mentioned in Charak Samhita for general conditions. In Jvara, they have mentioned Krodha, Pravata, Vyayaman, Kashayanscha Vivarjet. So Acharya Charak has explained in case of Navajvara, particularly Navajvara or initial stage of fever, one must avoid anger and krodh, which is a dosha of manas. So if they are saying this, they are definitely suggesting a usage of Sattvavajaya in this Jvara Chikitsa. There are explanations of Jvara caused due to excessive Krodha, and that can be treated with Sadvakya, that is good advice. Okay, or Kamya Artha, giving desired objects, or Manodnya Artha, giving pleasing objects, and that comes in again Jvara Chikitsa, Krodhajanya Jvara. Okay. Then Ashwasana Chikitsa or assurance is every now and then we are using in most of the cases. In case of Jvara also they have mentioned that in particularly case of Bhayaja Jvara and Shokaja Jvara, that is it is to be understood and it is to be applied. Then Vichitraischa Vishair Nashet Smritim, particularly Jvara when it is happening by remembering about different and surprising incidents in his or her life. That is being specified in Charak Chikitsa. Please excuse me for HI. It should be Charak CHI. Adhyay 3 324 is this sutra number. So here also you have to make use of Sattvavajaya in that sense. Next, please. In Raja Yakshma, they have mentioned about Harshana Ashvasanehi. In Harshana, or including happiness in patient, or Ashvasan Chikitsa, providing assurance, are mentioned as the treatment aspect of Rajakshma. And why Rajakshma? We did that in COVID, we did that in HIV, we are doing it in cancer, in many other conditions. So Harshana and Ashvasana is another modality of Chikitsa. Next, please. In Unmada, can also see the sutra from Charaka that Ashvasayat Surudvam Tam Vakyai Dharmartha Samhitaihi. So this is the Chikitsa by a friend who is applied again in Unmada Chikitsa, and this type of treatment method can be associated with modern counseling methods by various techniques. Already we have spoken about it. Moral speech and virtuous words are used as well. Appropriate guidance and suggestions are given, and measures like including inducing fear in the mind by exhibiting surprising events or showing extraordinary things for distraction are also used. Now here it is other way around. In earlier, that fear has to be removed, but here fear has to be induced for particular movement. That is different aspect. Okay, then already this have already mentioned that kama, shoka, bhaya, krodha, they can be utilized for kama, shoka, bhaya, krodha, etc. be replacement by opposite emotions, and it could be performed. And I explained about pratipaksha bhavana also earlier. Next, please. In apasmar, again you can see that vijnana, that is wisdom, dhairya, that is courage, smriti, memory, samadhi, that is meditative knowledge, are values that are inculcated in apasmar friends, well-wishers, and religious sermons. So religious sermons here will go again into Daiva Pasha. So that's what I was telling, that there is nothing like alone Sattvavajaya, there is nothing like alone Yukti Vapasha. There is always a combination. So Hikka Shitambu Seka Sasa Traso Vismapanam Bhayam Krodha Harsha Priyod Vega Hikka Prachavana Mata. So there are certain measures explained by Acharya Charak which alleviate hikka, like distraction from the thoughts. So that is one. Inducing fear, that is another. Anger, that is then anxiety and sudden happiness. Now I give example, the common example which many people colloquially they do, though it is not that safe. But in some of the cases I've heard and I've seen also, people they take agarbatti, jalti hui agarbatti, and they are say do and try to take it closer. They don't put it inside, but because of the bayam, that hiccups will get seized. Okay, or you close nose and stop taking breath, and particular moment you feel that I am going to die, and because of the movement of vayu and also bayam, you can see that it is hikka is getting seized. So again these are coming as one of the Sattvavajaya Chikitsa. Next, please. In Visarpa, that is Agni Visarpa particularly, Krodha Vyayama Surya Agni Pravatascha Vivarjayat. Now, in treatment modality, they have mentioned that you should not have these kind of conditions while you give treatment of Visarpa. In Madatya, they have also given that Harshana Chikitsa is mentioned as a treatment method in Madatya, that is alcoholism and intoxication, Vanani Ramaniyani, then Vishadani, Annapanani, or Malyani, Gandhayogascha, Vansansi, Vimalani, then Gandharva Shabdaha. So all these were mentioned in those times. Nowadays we replace it with asking them to do some hobbies, to listen to music by headphones or things like that, and it really makes a sense. Okay, so these are also part and parcel of this kind of chikitsa. Now please let me know whether if we have got time I can go ahead, otherwise I think we should stop here, and if there are any particular queries we can answer them. Actually I have got many other slides left out, but then I stop here because I know it is already 10:35.
Dr. Snehal, if you can just unmute the mic and answer, sir. Do we have any questions? Then we can put in the chat box.
Sir, you can
You can
extend
ask
for
me
more
directly.
5.
Ask me directly. Hello, hello,
Snail, sir, we couldn't hear you.
Sir, we can
hello.
extend for 5.
5 minutes. Okay. So just go ahead with the slides, or you can ask question. We can take question answer session. I don't mind. Do we have questions, or do we have any other comments or suggestions? We can take those, because I don't claim that I know everything. I'll be more to learn from all of you. You can put, so you can put, and please be verbal rather than putting into chat box. Let them speak so that we all can hear.
Yeah, I'll just change the settings. I'll just give me just two
Yeah, yeah,
seconds.
yeah.
Okay, I've given the permission of doctors to unmute. The
Yeah.
participants can unmute.
But be quick because we are running short of time. Actually, it's 9:40 now. 9:45,
Anju ma'am,
10:45.
Can you unmute your mic?
Yes, hello,
Yeah,
Ashish sir.
yeah.
Yes, sir. Very thanks a lot. Wonderful session. Sir, there are
Thank
actually
you.
a lot of questions, but I would first like to ask, we come across a lot of patients, and
Hmm.
then, the way you explained, sir. So I think every patient has got some or the other, the problems with the mind, where we
Hmm.
need to counsel. So, sir, first of all, when we are taking the history, I mean, is there
Hmm.
any kind of a way, method where we can actually, record these kinds of questions that we ask? Or because, I mean, is there any kind of, do you have any kind of a pro forma, like you're
See,
prepared where
basically,
you
basically, we are
interact with the
not
patients?
alone working as a counselor.
Hmm.
We are not working alone as a clinical psychologist. So they follow certain protocol, but we may not, because we are not alone looking at only mind. We are supposed to look at patient as a holistic way, right? So based on the complaints with which person comes to us, we have to go tactfully and then jump to particular core issue. For example, I give example. One patient came to me at my Vile Parle clinic long back, mid-aged lady around 30 years, and she came to me with a complaint of she's not able to sleep for a long time, and she is not able to recall small things, and she has lost her 5 mobile phones costing around 550,000 each in last 1.5 to 2 months. Okay. Now this was the basic question with which she has approached. Now one can just give some medication, right, some Brahmi and Smruti Sagar and whatnot, and get away with. But if you do, then I don't think that we are doing justice with that kind of patient. So we have to probe into, and I did that way. And when I went much deeper, then the thing came to surface that that female had fights with her spouse. Okay, on the very trivial issue that that husband wanted to have issues, and she was saying, no, you first get settled down, and then only we can plan for family. Okay, she happens to be head of HR division of one of the reputed multinationals. So very intelligent girl, And she said, sir, if I am not able to recollect the names of my colleagues and subordinates, then it is going to be very difficult because I'm heading HR department and I'm supposed to call everyone by name. And that is the culture, work culture. And I see person and I don't recollect the name. And I started, missing out my important documents and my mobile phones and things like that. And then I said, okay, let me get more deeper. And then she cried, she got cathetized. And when she explained about the fights and the difference of opinion between husband, then I said, dear, do you realize that what you are doing is your response, or that is what we call in mental health language, that escape mechanism of mind, because you don't want to recollect those particular incidences now and then, and your mind has started learning to shut down those memory gates, and then while doing that it started sipping into presence also, and you are not able to recollect the names, you are not able to remember where you have kept your phone or other important files or things like that. So you required to bring your husband, and we have to go to the root cause analysis, what we call, and then resolve it. And then that fellow came, then we had 2 3 sessions, and then they came to some common conclusion. And within 2 weeks she could start sleeping, she could recall recollecting everything, though we had given some medicine for the sake of benefit of patient and feeling better that I have taken medicine. But within heart, I was very sure that the role of these other activities were very important. So from this you can understand, there is nothing like a standardized protocol which go with. But even if we stick to our standardized protocol of Uyam, Vicharyam, and all that aspect, what I've discussed, which we have learned in Padartha Vidyan and in Chikitsa also, I think that will be a pointer for us and it can take us further.
Okay. Thank you very much, sir.
Yeah,
Can
thanks.
I ask one more question? Or,
Yeah,
sir, what do you think about past regression life therapy? I mean, is it really very helpful?
I think this is
Because
out of
I,
context. We are speaking on Sattvavajaya, and
Chatwal.
Sattvavajaya doesn't have any connection with that. So we will discuss later.
Okay, okay, sir. Thank you.
Thank you. Anybody else apart from that?
Good evening, sir.
Evening, sir.
Yeah, who's that?
My question is, I'm Dr. Snehil. Sir, my question is, you said that there are opposite emotions which can be
Yeah,
used therapeutically.
yeah.
So can you list down the opposite emotions and how to utilize that in the clinical practice?
Okay, bhaya and particularly fear and fearlessness. Okay, or pain and misery and pleasure. Okay, or agitated, getting agitated and feeling calm. Okay, so likewise, so many things are there. You can have list actually, but what is important is not the use of terms. You have to put it to that particular module. For example, when a person is agitated and you say you replace it with serene or you replace it with calmness, then it will not work by saying so. So you have to create a situation. You have to create or dig out the memory of that person, find out whether he had been any particular position or particular situation in his entire lifespan when he felt much serene, much calm. Then put him using different techniques like imagery or maybe hypno, maybe other thing, or just by imagination. You put him to that particular and anchor that completely. And when he is in that agitation, then slowly you see whether he is able to feel that change, transformation. Secondly, you can use some technique, yogic techniques also, like or forget yogic technique. I know that you are a very ardent practitioner of vipassana. So even the very basic, that is Satyanapan, if you ask him to do that, the slow and steadily that aggression will also come down, or that anxiety will also come down. So basically, you have to choose between opposites and put to task, but not by mere word, but by various tools which are, inculcated, interwoven, and to be utilized. There is yet another very important part I missed out in my speech, and that is Naishtiki Chikitsa. There is a mention of Naishtiki Chikitsa in Ayurveda, and in Naishtiki Chikitsa, they have mentioned that Chikitsa, Nishtha, Dukha Moksho, Moksha Rupa, Tadartha Bhuta, Naishtiki. And there they are mentioning that it has to be Satu Naishtiki Ya Vinopadham. And Vinopadham means Trishna Vina, Trishna Shunya, Pravritti Moksha Phala Bhavanti Iti Artha by Chakrapani. So, Atyantika Dukkha Chikitsa or Moksha Sadhana Chikitsa is an Naishtiki Chikitsa, and that is Yanishta Sa Param Gatim. That is another saying in Shastra. So, in certain cases, you have to take the spiritual aspect also to this play and make that person understand the holistic canvas. Okay, and that also helps in a great way. Now, the positive psychology, which is the latest field in the modern psychology, they are also speaking about the same aspect of what we have just now spoken in Naishtiki Chikitsa. Okay, in positive psychology, what they have said, the basis for most of the world's religion begin with a path toward inner peace, deeper meaning, and greater enlightenment. The hallmark of positive Chikitsa is all these, and that is what they have mentioned. Now, they have also said that one can promote different pathways to happiness. They believe it begins with knowing your true self and acting in accordance with your virtues. Now, again, this reminds me Sadvritta of Ayurveda. So, are the wisdom which is there in our ancient Ayurvedic treatise, and now modern people they are speaking one by one, and the three pillars they have mentioned about this positive psychology, and that is connecting with others, then savoring pleasure, that to accept, understand that pleasure, and developing sense of gratitude. So that is what is the newer concept of positive psychology. The another important part is REBT. So REBT is coined by Albert Ellis, one of the well-known psychologists in clinical psychologists in 1950s, and he actually mentions that uh, some people they have got uh, habit of saying that I should do, I must do, or you must do that. There is a disciplinarian pattern in their behavior, and if they don't live up to that particular expectation which they have created for themselves or for their other colleagues or their family members, then there is a distress in that particular family or in their own life. So how to deal that distress, because irrational beliefs about life expectations can cause increase emotional distress, and REBT, that is rational emotive behavioral therapy, focuses on challenging and disrupting beliefs, and that can be understood by very simple 6-step methodology. I am just giving in 2 minutes and finish this. So there is a formula of ABC and DEF. So A starts from activating event, which is creating difficult situation or undesirable or absurdities in your life. Then that leads to belief around these events, and may be rational or irrational, many times irrational. Then that leads to consequences, either positive or negative, which arise from our rational or irrational beliefs. And to challenge these unhealthy beliefs or in this REBT can be summed up by another set of alphabets, that is DEF, that is disrupting or reconstructing irrational beliefs or thoughts, which we have seen in CBT anyway. So I don't get into details again. Then E means creating more effective, efficient belief and thoughts. Okay, and rational also. And F means feeling better by incorporating these new rational beliefs and thoughts in response to activating events. So how, see, pain is going to be there, but whether you are having pain or whether you have got suffering, that is the difference. And that can be achieved by how you react to it. So again, I think the importance of simple technique, important technique like mindfulness or the dhyan, which is there in Vijnan Bhairav Tantra also, apart from Vipassana, you can see in some Upanishadic texts. I think all those are going to be useful for making our patients and even our life fulfill and better. And with this note, I think we should stop because it's 10 minutes to 11. And I wish to thanks once again to organizers and Dr. Snail, Dr. Hima, and once again thankful to Dr. Gala sir because he always emphasized the aspect of mind and the role of mind in treating patient. So I think we should look at this one-liner Sattvavajaya Chikitsa in our entire syllabus in a much serious way, and we should apply it to our day-to-day practice, though we are already doing it knowingly or unknowingly, but now with proper vision we should cultivate and we should utilize it more and more. And maybe one day, if time permits, we can also discuss on the Vipassana. Thank you very much.
Thank you, Dr. Ashish, sir, for sharing your invaluable and knowledge and insight with us today. We are grateful for your time and expertise in the same. A very heartful thanks to all the participants for joining us and actively participating in the Gyaan Vardhini session. So, I will just in shortly conclude my session for today. We With that, we with a great sincerity to each and every one of you. We look forward to see you again soon for the next session also. Thank you everyone and have a wonderful evening. Basically night. So good night everyone and thank you for joining us.